Hey, my name is Devin Marble. I work for VRpatients, and this is Maggie.
Hi, I'm Maggie Lysett. I'm a nurse practitioner.
So I just wanted to have a little sit-inside chat with you
Sure.
about like nursing and simulation and to kind of get your perspective. So I did prepare Maggie for this, so I hope you don't mind me putting you on the spot a little bit.
Well, it is what it is.
It is what it is. So how long you been nursing and doing patient care and stuff?
I've been an RN since 2008 and NP since 2012.
And you also teach, right?
Yes.
And where do you teach?
At University of Cincinnati. Faculty there.
Cool. And that's where we are now. It's a beautiful place. Come check it out. I used to teach as well, but I used to teach paramedics. It was like adjunct faculty, get sim, and that type of stuff.
Yeah.
A little bit different. Lots of emergent care.
Okay.
So what I wanted to talk to you today about was why we do simulation the way that we do. So everybody knows, I do immersive virtual reality simulation, mixed reality simulation. I don't think that that's a replacement. I think that there's a place for that. Mm-hmm. But in terms of teaching students at scale, meaning they don't always have to be standing in front of you to learn to become a better nurse and get better. Mm-hmm. I feel like you have to have an immersive solution as a tool in the tool belt. So the question that I have for you is, why do when we do simulation, traditional simulation, mm-hmm. why do we do it with 6 or 10 students around a single simulator?
Well, I don't know the cost of this simulator, but I imagine it's pretty high. And the space that would be required to house 100 of these guys is just not feasible. So we have to buddy up and share.
Yeah.
Yeah.
Do you know when the first manikin was like created, invented? The mannequin, his name was Sim 1.
Oh, okay, yeah.
1966.
Okay.
Actually looked old school. Looked just like this. Actually, it was a white mannequin, of course. But meaning like it was a metal robotic type thing. Maybe it was a robotic, but it was a metal guy with rubber skin.
Yeah.
It was like, and it's 59. Yeah, right. Hollowed out eyes.
Yeah.
And it's 59 years later.
We're still using that. There he is.
And I understand that this guy plugs in, he connects to the internet. How much does this thing cost? This is probably an $85,000 mannequin right here. And the other room is the birthing mannequin. Now I call you like $125,000.
Yeah.
But fundamentally, it's the same traditional simulation.
Yeah, we haven't come too far.
Yeah. Well, I don't want to say
in a lot of ways.
I think the industry has come a long ways for traditional sim. Like,
right.
These things are very complicated. However, we have a nursing shortage, right? And so it kind of feels like we can't keep simming the same way if we want to actually solve problems for healthcare and produce more nurses. Okay, so I'm going to pose another question for you.
Okay.
I've been to a lot of conferences, spoken to a lot of nurse leaders in the national stands, so like in Axel and over near NLN and then just boots on the ground nurses, and a lot of them come to our booth and talk, and then I visit schools like this and talk to nurses, talk to educators, and one of the questions that always comes my way is, when are you going to get multiplayer? And they're asking about VRpatients. When are you going to get multiplayer? When are you going to get multiplayer? Why do you think these nurses, nurse educators, boots on the ground simulators, these technologists, why are they asking for multiplayer?
Well, actually, we just did that when we did our sim just earlier.
So
we stepped in because when you're in a real life scenario with your patient, I mean, you're not just there by yourself. Like, healthcare is a team sport. So you have lots of different levels of skills and on your care team. So it makes it more real life when you're training a nurse to know that, yes, you can call someone in. Like, we did a sim with a violent patient, and
you asked me to come in
and help, which is very real life. You're going to get somebody else to help you.
Okay, this is interesting. Let me help define a little bit. When they're asking for multiplayer, what they're asking for is multiple nurses, multiple clinicians in the headset in the room at the same time, like remote.
Yeah.
And
Okay.
so let me ask you, and just straight real experiences, how many times have you been in a situation in real life treating a patient where there have been 4, 5, 6, 10 clinical people standing around the patient helping you treat the patient?
10, a code.
A code.
Yeah.
Me too.
Yeah.
Right? Someone's dying.
Yes.
I've also experienced pediatrics. You're right. When a sick kid comes in and it's a problem, all hands on deck.
Yeah. So I was going to say 4 is a lot more common.
Tell me about that.
So you're an ICU nurse and you're admitting a new sick patient, like Charlie just said. All hands on deck. Everybody's going to come in, help you get them hooked up, help assess them, help you get to vitals and
but that's
physician stuff. Yeah. Or
what happens once they're in?
Once they're in, if there's some sort of emergency code.
Yeah. So what we're talking about here is we're skipping over all the care time in between, where it's you and the patient. And in ICU, before COVID, it was 2-to-1 ratio was like the rule. And then COVID hit, and it's probably like 4-to-1 in ICU, which safety is an issue there.
Right.
My experiences, and I'd be curious about your experiences, but when I worked with nurses in the hospital, they were on their own. They were outnumbered by patients. It was 6-to-1, 8-to-1. And yeah, they could call in for help. Yes, for unique circumstances, a violent patient comes in, someone comes in to help out, but then they have to go back to their unit.
Or their patient.
And it's you. You are in charge of that patient. You are in charge of getting them through the door, communicating, translating from the doctor to the patient, initiating treatment. You are the healthcare lead for that patient's care. You might have a tech, but they're assisting with task-oriented procedures.
Yeah.
So I want to rewind. Why do you think our simulationists, our nurse technologists are asking for multiplayer and immersive clinical simulation? It's okay if you don't know. I'm just really pushing,
Well, I guess maybe that's what they're used to.
Maybe that's what they're used to. Maybe it's because for 60 years,
yeah,
this is how we've been doing it.
Yeah.
And the reason we've been doing it this way is because it's been the limits of what's possible. But if you have an institution like this one and you have 35 or 50 students and 2 sim rooms, 2 manikins, you probably need an excellent technologist like the name behind the camera over here to help out with those sims individually.
Mm-hmm.
So that's 1 to 2 people operating the simulations. How are you going to get those 35 students through the sim day? You have to group them up.
Mm-hmm.
And then how many of them get to be the team lead? If it's a 10-minute sim, and you have 35 of them, you have an hour and a half of straight nonstop simulation just so each of them can get a taste of what it's like to be the scene lead. But that removes or leaves out the fact that maybe there's setup, there's reset up, you were in there just watching, right? So you just saw how the sim went. If you're going to switch spots with the person who was leading the sim, now you don't answer.
Yeah. Right. Yeah, that makes sense.
So I would, I want to make an assertion, and I'm curious what you think for this.
Okay.
The reason why people are asking for multiplayer is because it's the way we've been simulating for the last 60 years. It's hard to think about doing simulation in a different way. Like the student puts on a headset, they're completely immersed, and while they're taking care of the patient, they don't actually need anyone to interrupt them. They can just focus on the patient. And when they remove the headset, there can be this debriefing time. So I want to make the assertion that what the industry might actually need is the ability to have a group work, multiplayer pre-brief time, all in headset, where you and your students can talk about what they're all about to experience. That they're all about to experience an NSTEMI, an abusive patient, an opioid patient, a measles patient, because measles is back. We can talk about that on another Fireside chat. And so they need that pre-brief, that pre-work, because then they all need to go into the simulation and practice what it's going to be like in the real world, where it's it's going for the majority of your care time. You are the sole person responsible. It's just you and the patient. And then when you're done with that sim, to come back in this learning environment, back into the multiplayer environment to post-brief, to debrief with this wise person who has all the knowledge of how'd that go? What'd you experience? Were you nervous? Did you feel anxiety? Do you want to try again? You didn't hurt anyone.
Yeah, right.
Try again.
Yeah.
Does that resonate with you, or am I just way out on another planet?
No, that's perfect.
I don't want to say it's perfect.
Excellent.
But poke holes in this, because I think that we're talking about something that's really important, because as immersive comes and education faces the need to adopt new technologies like artificial intelligence, like virtual reality and mixed reality, it forces us to think about, do we have to do things differently? And why do we do things the way we've been doing them? So I'm really wondering, am I off base here? Do you think that I'm wrong, that we know we need multiplayer?
I think having that option, like you mentioned, where everybody can kind of discuss together is good. But I also think that the priority should be on the student with one-on-one time with the patient, because that is how it is in real life.
Because you work as a nurse practitioner now, right?
Yeah.
What's it like? What's one typical patient encounter like?
It's me and the patient.
It's just you and the patient.
Yeah. And it's harder. So for the student, it's harder for them to be one-on-one. Like, as you mentioned, if there's 6 of them around and somebody else was the lead and it's their turn, they already know what to do. Whereas if it's just you and the patient, you have to really critically think, and you're solo. So you have to, it's harder. And that's better.
What
More
about
of a challenge for the student,
100%?
which is what we want.
What about multi-patient? Can you name an instance where you had to treat multiple patients at once?
Yes. Is bedside nurse?
Tell me.
You mean like
At the same time. I'm not talking about going room to room.
Oh, okay.
Okay, I'm talking about, because room to room is not multi-patient. That is
That's one-on-one.
successive
Yeah,
patients.
successive. Okay.
So what's a time where you had to do multiple patients? And let's just throw mom, baby, labor, and delivery. It's its own beast. That's a separate discussion. That's 2 patients.
Right.
Okay. Outside of a delivery of a baby, which I would argue always needs to be a practical simulation. What's a time where you had to have multi-patient?
I don't know if there has been one.
Mass casualty.
That's what I was going to say.
Right.
Fortunately,
Boston Marathon.
I have not been a part of that.
Right.
So,
As a paramedic, I've been as a paramedic who was on call, right? Who needed to be waiting for those instances.
Yeah.
I can think of one.
Yeah.
And it was a motor vehicle collision.
Okay.
And maybe that's one instance. There were a couple motor vehicle collisions I went to, but that is one instance.
Yeah. I don't think I've ever.
And when they get to the emergency department, you might get multiple patients that come in, but where do they go? To their individual rooms.
With a bunch of providers coming in.
Is there ever an instance where you walk in as a bedside nurse to a room and there might be those HIPAA-compliant curtains in between each patient bed, and there's 6 patients in it? Do you ever walk in and whip open all the curtains and pull all of the computers together and go, okay, folks, John, Susie, we're going to do this together?
You know what? I just thought of something as you were saying that. I did a medical mission trip to Honduras.
Uh-huh.
And in that hospital setting, it was labor and delivery, but there were about 4 women in one room, all giving birth.
Oh my gosh.
Yes. I was just walking through. So I did not have to
Were there like catcher's mitts? So they're like, catch.
basically.
Oh my goodness.
And then in the hallway, they had these poor women lined up with their babies then. But that's like how they do that in Honduras.
Okay, wow.
Which is, I think, the second poorest country in the Western Hemisphere. So no, other than that.
Okay, so we're talking about how do we serve the shortage, the great need, right? We don't want to always only be simulating on just heart attack patients, on just codes, on just ACLS PALS. You have to practice that stuff. You have to stay competent at it, but codes aren't every patient. It's abdominal pain, 24-year-old female, right?
Yeah.
And these are these general practitioner or geriatrics, right? You have an elder patient, they're aging out, they need more medical care more frequently. And it's bedside nurse, frequent one-on-one time. It is successive simulations to practice what it's like to have to treat and manage multiple patients in an order or in a given amount of time where you have an hour, you have 4 patients, you need to go from room to room and put in your orders or give your treatments. And then we're going to debrief in a group setting so we can talk about what went well, what didn't go well. So that's not multiplayer. That's not multi-patient.
Okay.
That is identifying how do we tackle the true need of the industry with the new technology.
Yeah.
And that is one-on-one healthcare simulation time with a patient. The ability to fail often and fail fast. To make mistakes and not kill anybody. And to understand what it's like to make decisions as a healthcare provider. Have I misspoke on anything? Please push.
I don't think so. I mean, I can see the desire to have that multiplayer. Like I said,
it's certainly flashy.
It's
cool.
Tempting. And again, like in a code situation or something like that. But that shouldn't be the day-to-day focus, the priority.
Well, look, I appreciate we're running out of time. So I really appreciate you sitting down for me and letting me kind of pepper you with new questions. And so I would be very happy for you to be my nurse if I ever got sick.
Oh, sick. Hopefully that doesn't happen.
Yeah.
Hopefully you don't have to rescue me from a car crash.
All right. Until next time for our next Sim Fireside. Maybe we'll make this a thing.
All right. Sounds good. Thanks, Tom.